Chantal Cyber suffered from a rare form of cancer. The tumor caused massive swelling in her face, blindness, loss of taste, and also loss of all smell. In addition, she could not be given any type of painkiller such as morphine because of the side effects it would have. She actively sought out a doctor who would be willing to assist her by giving her a lethal injection of barbiturates. She was denied any help in the matter and was found dead in her home. It is cases like this one that highlight the importance of the ongoing debate regarding euthanasia. Whereas many people cite the right to die on their own terms as a personal liberty, just as many people regard the idea as outlandish and immoral to the sanctity of life. When dealing with euthanasia, it is important to keep in mind there are two distinct types. Active euthanasia occurs when a physician or other party specifically tries to end a patient's life by inducing death. This is normally done with a drug overdose. In this case, the act of overdosing is the direct cause of the death. Passive euthanasia is when life support is withheld. This is mainly when a physician stops doing something. Passive euthanasia can result from a physician or spouse pulling the plug. In this case, it is the disease that kills the patient. The omission of treatment is secondary. Euthanasia dates back centuries. The Nazis used the term to justify their operations that killed thousands of people. Jack Kevorkian was the face of it in the late 90s. Even though these are serious cases, they gave the name a harsh stereotype that deters many people from still discussing the issue. Today, many people look upon euthanasia as a type of murder, even though many others look at it as a fast relief to an unbearably painful lifestyle. The question remains, how should it be classified under the law? The Death with Dignity National Center, an Oregon-based nonprofit organization, stands as one of the most prominent groups lobbying in defense of the Death with Dignity Act, as well as seeking to enact similar laws in other states. They maintain it as a patient's legal right to request a hastened, less painful death in the event of a terminal illness which is estimated to leave them with less than 6 months to live. Additionally, they cite even with today's modern pain management in its most extreme form fails to aid 5% of terminal patients suffering. And oftentimes a doctor is unable to provide sufficient medication to even begin proper pain management due to legal concerns and drug regulations. Furthermore, they contend that the physical pain and suffering is only one dimension. There is immeasurable psychological and emotional damage done by the loss of autonomy and dignity. One major pain elaborated on by Melissa Barber of the DDNC via email was, a key aspect of the Death with Dignity laws in Oregon and Washington is that the patient must be of sound mind and body to acknowledge they are self-administering and ingesting medication to hasten their deaths. Since the patient must be of sound mind and body for the lethal treatments to occur, the laws and general platform of the DDNC is voluntary euthanasia. It should be noted that the DDNC does not specifically advocate general euthanasia, as it is commonly thought of as lethal injection. Additionally, they cite the very term euthanasia is a loose, ambiguous concept that often implies a person's involuntary death. Euthanasia is illegal in the United States and has no relation to the two carefully written and regulated Death with Dignity laws, and there have been no efforts to expand it beyond its strict guidelines. This is a fine line of contention, but one that is maintained by strict legal provisions according to the DDNC. Euthanasia is legal everywhere within the United States, but voluntary euthanasia is available by prescription form in 2 states, Oregon and Washington. The Death with Dignity laws began in Oregon as Measure 16 in 1994. This law was legalized by an initiative in the general election and would successfully thwart both an initiative to repeal it and pressure from the federal government during the Bush administration. The laws allow for patients who meet strict criteria to initiate a voluntary process which alleviates medical professionals involved of any liability and allows a patient to end their life via lethal prescription. 10 states, aside from Washington and Oregon, have had recent DWD legal proposals, including Pennsylvania. In the majority of the states, however, the bills have either been defeated or stalled. The Pennsylvania bill is based on the Oregon model and was submitted in 2009 to the state Senate by state senators Leach, Boscola, and Washington, but the bill has since been stalled by the Judiciary Committee. Additionally, there have been 2 court cases over DWD laws that have recently taken place. In Montana, it was ruled there are no specific laws preventing doctors from adhering to DWD practices, while the Connecticut case, which asked the state's legal position on the issue, was rejected without any further clarification. To represent the other side of the spectrum, we interviewed a representative of the Catholic Archdiocese who decided to remain anonymous. The main point the priest brought up was that all life is sacred, and that if we start allowing people to use euthanasia to get out of terminal diseases, it is hard to draw a concrete line deciding who can and who cannot utilize it as an effective method. To gain a professional perspective, we also interviewed a geriatrics physician who also decided to remain anonymous. One of the main concerns of the geriatric physician was that it would be hard to acknowledge all parties' wishes when dealing with euthanasia, and also that only terminally ill patients should be given the opportunity to utilize it. The main special interest groups involved with euthanasia are Citizens United Resisting Euthanasia and Compassion and Choices, which is a pro-euthanasia group. As we've shown, euthanasia is an important topic in today's society. However, it is often overlooked because of other issues. Because of its delicate nature, many states and legislators overlook the subject, partially because of its connection to religious groups and social ramifications.